Hi, this is Phil Katzman. Today we're going to review a normal placenta to orient you to subsequent videos about abnormal placentas. So a normal placenta is, this is from a term pregnancy, which generally is 37 to 41 weeks gestational age. A normal placenta in that range is from 400 to 600 grams. The placenta is examined in three compartments. One is the umbilical cord. Second is the free membranes. And the third is the placental disc, which has two surfaces, the fetal surface and the maternal surface. So we'll start with the umbilical cord. The cord is normally inserted somewhere within the center of the disc, but it can also be attached at the margin or even within the membranes. And those latter two insertions are considered abnormal. The cord can be of various lengths, and generally we consider a cord over 70 centimeters as a long umbilical cord. The cord can also have varying twisting, which you can see in this cord, kind of like a barbershop pole, which may date me, but the coils generally are, or should be in the range of 1 to 3 per 10 centimeters. More than that is considered hypercoiled. Okay, now we looked at the membranes. The membranes are the extension of the chorion and amnion that envelop the amniotic sac where the baby is contained. And the membranes normally attach circumferentially around the edge of the disc, but the membranes can also insert away from the margin, which is called either circummarginate or circumvallate insertion. The membranes generally have a transparent appearance, or at least a non-opaque appearance, but there can be various abnormalities in the membranes, which include meconium deposition from meconium passed by the fetus, or signs of acute ascending infection, in which case the membranes contain lots of neutrophils and become cloudy. Now the disc itself, as I said at the beginning, has two surfaces, the fetal surface and the maternal surface. And within the chorioamnion runs the surface vascular supply, which are basically branches of the umbilical cord. The vessels include arteries and veins, and generally the arteries run over the veins, and that's how we can tell the difference. So right in this area here, this is a large vessel, but it's actually running underneath this vessel. So the larger vessel is a vein and the smaller vessel is an artery. The color of the fetal surface is usually blue-gray, and it's usually easy to see the vessels, but when there is acute inflammation, they can become obscured. The vessels usually run all the way to the edge of the disc in normal development. The other side of the placenta is the maternal surface, which is attached to the uterine wall. And you may be able to see that if I bend it a bit, that appears to be areas where the parenchyma divides. And that roughly estimates the presence of cotyledons, which are the subdivisions of the parenchyma. Normally the parenchyma is complete when the placenta is taken out. This area here is a little bit disrupted, but appears to be complete, a complete surface. But if there is an incomplete surface, then you think about things like accreta, where some of the placenta may still be attached to the uterine wall. The other thing we look for is whether there's any adherent blood clot to the surface of the disc, which may be associated with an abruption. So, in summary, we look at placentas, we look at the cord length, the cord coiling, the insertion of the membranes as well as the appearance of the membranes, and then we look at the fetal surface with its vascularity, as well as the maternal surface with its completeness and any lesions that are seen in it. Please note that when we are processing these placentas, we actually cut into the placenta, so we do like a bread loaf sectioning, and in that way we can see specific lesions that may be within the parenchyma. So that's the end of this session. Next we will look at some abnormal placentas.